I work with some of the largest pharma companies in the world. All of the marketing teams that we work with have said they are spending more time talking to their privacy lawyers, data ethics teams than they ever have, right? Because again, there's a lot of different regulatory laws to keep track of, especially if you're operating internationally. They always have to adhere to the regional regulatory requirements, right? So there's just a kind of a lot of questions, rightfully so, that lawyers are asking about, how can we continue to run our business effectively? How can we continue to drive better healthcare outcomes ultimately by leveraging data and still do that in a compliant way? I might have some bias here working at LiveRamp, but the idea about the centrality of deterministically linking data is really, really crucial. You think about the requirements that regulators are asking marketers to take on, which is that if somebody opts out of targeted marketing, that you can show an auditor that you've actually gone through the proper steps to actually suppress that individual. We can work with and partner with so that if we get a list from a marketer of an audience and an opt-out list, we can immediately match them deterministically to our audience graph and ensure they are suppressed from all marketing campaigns. It's a wonderful way to go to your legal team and say, these folks have opted out. We can show an auditor that we did everything needed to ensure we are not going to target this individual. Ultimately, that's a lot more effective than thinking about, well, we're just going to move to contextual targeting. Now, when you're leveraging data, everyone that we're delivering a message to are folks that we know could have an interest in the products or services we're delivering. So that I think is really powerful.